Hello, my name is Dr. Nicoletta Frescos. I'm from Melbourne, Australia. My background is a podiatrist and I'm also the Allied Health Research Lead at the Northern Health Hospital in the outskirts of Melbourne, Australia. I'm delighted to be part of this Foot International World Diabetes Awareness Day and presenting to the Western Pacific region. So let's have a global look at diabetes foot disease. Diabetes is, as we know, highly prevalent with over 463 million people diagnosed with diabetes globally. Diabetes foot disease is a massive and growing problem globally. About 25%, that is 1 in 4 people, will develop a foot ulcer in their lifetime. And most of these ulcers will become infected, which can result in an amputation with up to 1 million amputations per year. Diabetes has become the leading cause of amputation, and we know that around the world, every 30 seconds, a lower limb amputation occurs due to diabetes related foot ulcers. But amputations are preventable with 85% that can be avoided if the correct line of treatment is provided. Now, DFU recurrence is also quite frequent. 40% of wounds will reoccur within 1 year and up to 65% within 3 years. Up to 70% of patients who undergo a diabetes related amputation will die within a 5 year period, which is higher than some of the quite common cancers. The financial burden of diabetes is estimated to be globally around 673 billion of the annual healthcare expenditure, although that figure seems to be quite different from different literature in different countries. And of that, diabetes foot ulcers account for about, in the US, 38 billion, and in the UK, up to about 1.3 million pounds. So the prevalence of diabetes mellitus will multiply rapidly with a more pronounced increase in the Western Pacific, Southeast Asia, Mediterranean, North African regions. And this is what's been predicted by the International Diabetes Foundation. The high costs for diabetes foot disease is reflected by the complexity and the diverse presentations of these diabetic foot ulcers. So foot ulcers may heal within weeks, they could persist for months and years, or they could progress to amputation. This is due to the chronic and insidious nature of diabetes foot disease, which is complicated by peripheral arterial disease, and if in that case, and or infection, or it could be peripheral arterial disease, or it could be any other comorbidity that's related to diabetes mellitus. And often this necessitates prolonged and intensive treatment. Escalating the costs is both the demand for resources and the financial support required for patients and healthcare providers and the society. Healthcare costs for diabetes foot disease can either be direct costs or indirect costs. The direct healthcare costs may include long and repeated hospital stays and high bed occupancy, rehabilitation, medications, provision of wound dressings and offloading devices, diagnostic tests and imaging, and artificial limbs. Costs may also include consultations with various healthcare professionals, varying from vascular physicians through to podiatrists, nurses, etc. Surgical procedures may be revascularization and amputations. Indirect costs can include loss of income or productivity, reduced quality of life, or caregiving burden. The indirect costs are very hard to get a sum and data on because there are so many indirect costs that we do not account for in our overall estimation of the cost for diabetes foot disease. The global financial burden of diabetes foot disease varies between countries, and also the collation of that information is quite outdated because we know that the prevalence of diabetes is increasing substantially. So here you can see a summary of what data I could find from various countries. The United States states that 33% of the annual cost of their healthcare expenditure is related to diabetes foot disease, 0.9% for the United Kingdom. Canada states that its annual cost per patient in international dollars in 2000, that's quite a while ago, was 22,000 or 23,000 international dollars, and it goes on. So it's really difficult to get a good figure across the globe as to what the actual diabetes cost is. When it comes to the Western Pacific region, it was even harder to get a summary of what the actual burden is. The latest study that I was able to find was conducted in Malaysia by Dr. Hari Krishna, and that was published in 2022, and it compared the hospital admission rates between public and private. It compared the minor amputation, major amputation, and then the overall cost per patient per year that was calculated through a Markov model was identified to be in the public system 5,901 Malaysian dollars, which is equivalent to 2,193 Australian. And the reason I'm using the Australian dollars is to try and get a better idea of the cost between the three countries. Australia, the last burden study that, or economic study that I could find, was conducted in 2015, and overall the cost of diabetes foot disease was 348 million in the public hospital system. Minor amputations and major amputations varied, of course, but they were much higher than what the cost in Malaysia. The other Western Pacific region country that I could find a study on was conducted in 2015, and it was based on 214 patients, and the total healthcare cost in regards to diabetes was $1.05 million, and 50% of these were related to amputations. A study published this year looked at the estimated cost of treating two standardized diabetic foot ulcers of different severity. It was a global study of the 7 regions with a total of 51 centres, and data was collected over a fixed period of time. So with wound 1, the average estimated cost across the 7 regions was around $2,942, and for wound number 2 it was $17,403. The average time needed to cover that estimated cost for treating wound 1 was equivalent to 8.6 months of salary, and for wound 2, 22.7 months of salary. The authors used the purchasing power parity to be able to directly compare costs across the different countries. So this cost is sort of likened to the Big Mac index. When it came to the Western Pacific, for wound 1, the mean cost was around 3,200, and for wound 2, 18,000. So this is probably one of the only studies that has been able to do a comparison of similar data for particular types of wounds. A stepped approach for health costings in Australia was conducted in 2022 around the same time as Dr. Hari Krishna's study, which is fairly similar. I'm pleased to say that our study has been accepted for publication. This was announced yesterday. So we did a step approach during a scoping review, qualitative interviews with key opinion leaders, collated that with the systematic review results, and then we put all that data together to undertake a health economic evaluation. There were some common themes. There were differences in treatment algorithms throughout the different regions of Australia and different professions. There were different resources and services used, and we also highlighted that the referral pathways also varied, but were more likely to start to follow the Diabetes Feet Australia guidelines. So, in summary, what we did was put it into what's called a Markov model, which estimates the average cost per year to treat a diabetic foot patient, and it goes through the seven health states in weekly cycles over a period of a year. So we collected the data on closed wound, active wound, open wound post-amputation, and closed wound post-amputation. And all the variables are listed there, ranging from hospital admissions, inpatient, outpatient, healthcare practitioners, utilization, medication, wound dressing devices, and other costs. In a nutshell, the overall cost per patient per annum for Australia is around $20,600. The largest cost was from outpatient community care, which attributed to 44%, followed by wound debridement, 25%, and then hospital admissions. So what this calculation or economic evaluation provided with for us was a 5-year prediction of the burden for diabetes foot disease in Australia. So in 2022, the cost was 839 million. It is predicted in the 5-year period that the cost will increase based on the population increase and the increasing prevalence of diabetes mellitus. It will be around $1.2 million for the management of diabetes foot disease if we do not properly address this problem. So, in conclusion, there is a wide disparity globally for the cost of treatment of diabetes foot disease. But if we focus on the Western Pacific region, number one, we do not have enough data, but also the disparity is due to the different types of economies. Some countries within the Western Pacific region are classified as high income, whereas others are middle or low income economies. And given the complexity and multifaceted nature of diabetes foot disease, along with the variability in the management practice across the healthcare settings and across the regions, data may not fully capture all aspects of resource utilizations. In particular, for low-income countries, the figures are highly underestimated due to the poor data collection and due to the high proportion of undiagnosed diabetes. So future research should expand economic evaluations of diabetes foot disease to capture indirect costs and also patient-related outcomes and the long-term financial impact. These elements are essential for building a more comprehensive understanding of the true economic burden of diabetes foot disease. Integrating real-world data will significantly improve the relevance and robustness of any future cost economic evaluation and cost-effectiveness analysis. What we should be doing is developing national or international registries to collect this type of data. And using these databases could enhance the accuracy of resource utilization estimates and also support evaluations of interventions in the real world settings. These are my references, and I thank you for the honour of presenting on this special day.